Hello, my name is Mose Kang. I am a nurse practitioner student at California Baptist University. Today I'm here to present Marburg virus disease. There are 10 objectives. Please refer to these objectives as I go. Number one, what is Marburg virus? It is a unique zoonotic RNA virus of filovirus family. It is a big words, but in easy terms, filovirus family is one kind of Ebola virus. So it has a very similar symptoms to Ebola virus. And zoonotic means it is comes from the animals. So in other words, this virus transmitted through the animals such as African fruit bat, which is the reservoir host. The African fruit bat's name is Rosetta's aegypticus. But also, this can be transmitted through other primates, such as monkeys. So, it was first identified in 1967. The first epidemic was in Marburg and Frankfurt in Germany. Even though those African fruit bat is living in the Africa, at the time they at Germany they were researching about some monkeys that came from Uganda, which also has an African fruit bat in Uganda. So probably fruit bat virus was transmitted to the monkeys, and that monkey was researched in Germany, and there was a first epidemic. And simultaneously, Belgrade in the former Yugoslavia had the same issue with the monkey at the time. So that's how Marburg virus was first case was noticed in the world. So clinical presentation after an incubation period of between 5 to 10 days. Usually the onset comes suddenly with the fever, chills, headache, and malaise. And after the onset, 3 to 5 days, symptoms may follow, such as a maculopapular rash on the trunk, severe watery diarrhea, abdominal pain, cramping, nausea, and vomiting. At this point, there is a usual they coined ghost-like drum feature, which is deep-set eyes, expressionless faces, and extreme lethargy. So this, even though this is just 3 to 5 days after, this is actually advanced stage, which is very, at this point, patient is becoming very lethargic and difficult to treat. And between after 5 to 7 days, there is an increasingly severe severity, and which expressed as jaundice, inflammation of the pancreas, severe weight loss, delirium, shock, liver failure, massive hemorrhaging, and multi-organ dysfunction. And the left picture shows the easy symptom showing with the early stage and advanced stage. And the method of transmission, as I said in the first slide, the Marburg virus is zoonotic RNA virus, which is uh, transmitted through the animals such as bat. But it can be also transmitted with the blood or body fluids and tissues of infected persons. And the prevalence and most common regions. So as you see in here, you see the total number of cases only 466 since 1967, which is not a lot. So this prevalence is very rare. But as you see, the mortality since 1967 is 80%. So the mortality is pretty high. And the most common region is, as you see, it's mostly African country, Kenya or Russia sometimes, Angola, Uganda. There were two cases in Western uh, Hemisphere, which is USA, Netherlands, and Germany, and sometimes Russia. Russia is more eastern side, but these cases usually the tourists went to the cave and they met the bed or they saw some carcasses and they got infected with the virus. So not yet. We haven't seen any live beds going out of the Africa. So usually it happens in the Africa region. So population at risk, people who live nearby those uh, African fruit beds. The study name is Rosettes aegypticus, or the people who treat the human patients, such as nurses, doctors, or any staffs who works in the quarantine, or non-human primates infected with Marburg virus, such as uh, monkey. That monkey was specifically green monkeys living in Africa. It seems they transmit the virus more often. So prevention strategy, currently there is only one way of prevention, which is avoiding fruit bats and sick non-human primates in Central Africa. And once outbreak is found, then infection control is the next best prevention strategy. So CDC and World Health Organization, who both together made a guideline as infection control for viral hemorrhagic fevers. This is old name, viral hemorrhagic fever. Now everyone says Marburg virus disease. So if you're interested, you can download this guide in the CDC website. And diagnostic tests. So this is a virus. So we can confirm this with the antigen capturing ELISA testing and IgM capture ELISA and PCR. But this is works within a few days of symptom of onset. So remember that. And virus isolation may also be performed, but this should only be done in a high containment laboratory with good laboratory practices, which in other words, um, skillful laboratorians are required and high technology is required. So not all the laboratories are able to perform virus isolation. And let's say a patient had infected and they got recovery, or in the later course of the disease, and we want to check if this patient is not going to transmit the virus anymore, or then we can check with the IgG capture ELISA. And the last case is in diseased patients. So let's say the patient has died and we want to check if this patient had Marburg virus or not. We can check there retrospectively by immunohistochemistry or virus isolation or PCR of blood or tissue specimens. And treatment, there is no specific treatment at this point. So supportive hospital therapy should be utilized, such as checking temperature and maintaining the good temperature is important. And in case of hemorrhaging, we need to have a blood transfusion in hand or IV in hand. Also, electrolyte is basic. We need to get a good electrolyte balances. And In secondary complication, infection can be a big thing, so antibiotics in hands will be a good idea, and oxygen to support. In international organizations, so WHO is the biggest organization participating in this virus, and these pictures are showing that at the time of outbreak in Angola in 2005, this is the real pictures they were working at the time. And other organizations such as UNICEF, World Vision, Red Cross, were all in helping in them in Angola. And also one of the big helper in laboratory is Bernard Notch Institute for Tropen Medicine in Hamburg, Germany, which they provide a laboratory that can distinguish the virus. And also CDC in United States participate in many outbreaks of this Marburg virus. That's why CDC and WHO may develop the guidelines for how to treat and how to isolate and control the infections efficiently. Also, many other European countries participate in treating and helping to quarantine this deadly virus, such as France, United Kingdom, and many African countries like Congo, Brazil, and a lot of institutes of African uh, infection controlling or institutes participated. And these are the references, and I have not included all the pictures in these references, and you can find those pictures in Google easily with the searching terms of the Marburg virus. Thank you for listening and have a good evening.